Checkmate-004 was the phase 1 trial looking at IPI and Nivo in combination in patients with melanoma. It was the first study looking at combination checkpoint inhibitors, and the data was initially presented at ASCO 2013, published in the New England Journal of Medicine concurrent with that presentation, and showed a response rate of 53% for melanoma patients and a rapid, quick response in those patients. That led to the design of the 069 trial comparing IPI-Nivo to IPI, and the 067 trial comparing IPI-Nivo to either IPI or Nivo, which led to the FDA approval of IPI-Nivo combination for patients with metastatic melanoma in 2015. So what we're presenting here is the long-term follow-up of those patients. And at 4 years, we're showing that 57% of patients are still alive. And no matter what your risk categorization, whether it's stratification by PD-L1 status, BRAF mutation status, LDH status, stage of disease, or whether you've had prior treatment or not, 49% of those patients are still alive at 4 years, and that's survival goes all the way up to 71% in some of the good risk patients. But even poor risk patients can do very well with Nivo and IPI. And then we also have a chance, because the treatment stopped at 2 years, to look at treatment-free survival in those patients who stopped treatment. And what we see is that 86% of patients who stopped treatment because they completed therapy are still alive 2 to 3 years afterwards, and 70% of patients who stopped treatment because of toxicity are still alive. And although that is enriched for groups of patients who have good performance status, meaning that there are more patients who've progressed if they have elevated LDH or prior treatment, or BRAF mutant disease, particularly if they had prior BRAF therapy. If you make it to that endpoint where treatment is stopped for either toxicity or for completing therapy, it doesn't matter what your prior risk status was.